Taking care of your oral health is crucial during pregnancy. Hormonal changes can make your gums more sensitive, increasing the risk of gum disease, cavities, and other dental problems. Why dental care is important during pregnancy. Number 1. Hormonal changes. Pregnancy hormones, especially progesterone and estrogen, can increase blood flow to the gums, leading to swelling, bleeding, and sensitivity. Number 2. Impact on baby. Poor oral health, such as untreated gum disease, has been linked to premature birth and low birth weight. Number 3. Cravings and morning sickness. Sugary cravings and acid exposure from vomiting can increase the risk of tooth decay. Dental care tips for pregnant women. Number 1. Maintain a good oral hygiene routine. Brush your teeth at least twice a day with fluoride toothpaste. Use a soft bristled toothbrush to avoid irritating sensitive gums. Floss daily to remove food particles and plaque between teeth. Number 2. Eat a balanced diet. Include calcium-rich foods, milk, yogurt, cheese, to strengthen teeth and bones. Consume vitamin D-rich foods, eggs, fatty fish, to support calcium absorption. Avoid sugary snacks and beverages to prevent cavities. Drink plenty of water to stay hydrated and reduce acid levels in your mouth. Number 3. Combat morning sickness. Rinse your mouth with a mixture of baking soda and water after vomiting to neutralize stomach acid. Wait 30 minutes before brushing your teeth to prevent enamel erosion. Number 4. Schedule dental checkups. Inform your dentist about your pregnancy. Routine cleanings and checkups are safe and recommended during pregnancy. The second trimester is the ideal time for non-emergency dental treatments. Number 5. Manage pregnancy gingivitis. If you experience swollen or bleeding gums, use an antibacterial mouthwash or warm saltwater rinse. Continue brushing and flossing gently, even if your gums are tender. Number 6. Stay alert for signs of dental issues. Watch for persistent gum swelling, tooth pain, or sores in your mouth. Promptly address any infections or tooth decay to prevent complications. Thank you for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with someone who might benefit from it.